we feel that this is an important day, not only for Congress, but for veterans and their families. VA has been underfunded for many years. Can you imagine? Out of 22 years, 19 years are late funding. And as a result of that, they're not able to get the kind of personnel they need to deliver the health care. And that has been the problem. We want to fix that problem. And one way of doing it is to have advance funding for VA. VA has the money, but we need the money on time. And in order to get it on time, we need that 1 year advance funding. And this is what we're asking for, and we believe that this will resolve lots of the problems that we're facing right now. And this will be good for our country, and of course good for the veterans and their families.
You know, the only thing more important than having enough money for veterans' health is to make sure it's timely and reliable. Because if you can't hire because you don't know what's money coming, or you can't fill vacancies, or you can't purchase equipment, you essentially ration health care. People cannot get it. We have a story of a young man here who needed mental counseling, and it only was 2 days a week because they didn't know what their money was coming from. And so his health care is set back. And we can't afford to let that happen. So we think this will give the reliability and certainty that you need. You know, there's only one thing I think more important than having enough resources in the VA, and that's to make sure those resources are delivered in a timely, predictable fashion. If you don't have that, you can't hire, you can't fill vacancies, you can't purchase equipment. You essentially ration health care. You know, the power that individuals have, especially veterans, is way more than people can imagine. If you go and visit your congressperson or your senator when they're home, not necessarily in Washington, but home, and they see you as a voter, and just tell your story of why the VA needs this or your experience as VA, that has enormous power. And as soon as you visit them and ask them to support this, they'll come back and they'll do it. See them at home, just tell your story. You don't have to be a high-paid lobbyist, and you can have power.
It was about 2 weeks ago, I think, Chairman Taka, we had a hearing in this very room, talked to members of the VSO about what their top priority was. And it was about advanced appropriations. And so, who really makes this happen are you guys. You people who are fighting for your veterans every day. You people who step up to the plate and talk about real-life situations and how our veterans are being impacted across this country in a negative way without advanced appropriations.
And quite frankly, it's been depressing to see how many years that Congress has not been able to get its act together, providing funding on time.
If you think about it, for those individuals who are incarcerated for whatever reason, they are assured their health care. We can do no less for the veterans of this great nation of ours.
This legislation is extremely important for two reasons. One, well, first of all, it's very important that we have adequate funding. That's one component. The second piece is to make sure that that funding is on time, and the advanced budgeting will definitely make sure if Congress, for whatever reasons, delayed in getting the budget cycle through, that this advanced funding will allow the VA to move forward.
I'm appearing today on behalf of 9 organizations. Partnership for VA Healthcare Budget Reform. Those organizations include AMVETS, Blinded Veterans of America, Disabled American Veterans, Paralyzed Veterans of America, Jewish War Veterans, Military Order of the Purple Heart, the American Legion, the Veterans of Foreign Wars, and the Vietnam Veterans of America. You know, we are a nation at war, making new sick and disabled veterans every day. And as you can see, there's some of us older veterans in this room as well as some of the younger veterans from the wars in Iraq and Afghanistan. And we're all trying to use the VA facilities. And unfortunately, health care for too long has been rationed to our nation's veterans, and we can no longer tolerate rationed health care. And so I want to thank Chairman Akaka and Chairman Filner and the lead Republicans on these bills, Senator Snowe and Representative Walter Jones, as well as all of the other members that are here today to support this legislation. I don't know how anyone can oppose legislation that would provide transparency to the budget process and provide a sufficient, timely, and predictable budget to VA so that veterans can get in and receive quality health care in a timely manner. I want to thank each and every one of you who are helping us to allow VA to provide timely, quality health care to our veterans, and who will help support the passage of this legislation. Thank you very much.
Right now, this financial crisis that we're in, veterans are suffering disproportionately, and as they always suffer disproportionately when we have a problem in housing, when we have a problem with employment, when we have a problem with medical care or shortage of nurses, or that there's always a veteran's impact. The other thing that I'm hoping to do from my subcommittee on disability assistance and memorial affairs in this term is to pass a presumption of service connectedness for PTSD. So if you serve in a war zone, you serve in Afghanistan or Iraq, and you come back here and you have to have a diagnosis and actually have the symptoms, and a psychiatrist or a doctor will diagnose you and write it out. From that point on, there are no more hurdles to jump over, nothing to prove. You get your treatment, you get your disability